So the reproductive hormones are really complex until you break them down into the four things you really need to know. And they're outlined here in the learning objectives. But the main four are follicle stimulating hormone, luteinizing hormone, estrogen, and progesterone. You should know the full reproductive system from key stage 3. If not, you can recap that in your own time. But we're going to focus on the four main hormones and include into it the fifth one, which is part of the male secondary sexual characteristics. If you learn the five main ones there, you're pretty much halfway through your understanding already. Just be able to recall what the hormone is, where it's made, and what it does is a big sort of step in the right direction. Unfortunately, they're not just going to ask you to recall stuff at GCSE. They may well put it into graphical forms. And what you need to do is be able to identify what is happening in each stages. We're going to cover that a little bit later with another graph. But in brief, follicle stimulating hormone causes the egg to ripen in the ovary. It matures it within the ovary. And luteinizing hormone, where it spikes there at about day 13, 14, is where the egg is actually released, and that's ovulation. From that point forth, the woman can become pregnant. We'll look into progesterone and estrogen in a little bit of detail in a second. As you can see in the wheel here on the first diagram, day 1 to day 5 is where the lining of the womb is shed. That's the period. So that's the starting point. As soon as the lining of the womb is shed, after day 5 roughly, it's not exact science, the lining of the womb will start to thicken between day 6 and about day 13. At day 14, the egg is released, and then from day 15 onwards, the egg can move through the fallopian tube and can be fertilized within that time. If by about 28 days it has not been fertilized, then the lining of the womb starts to shed and it repeats the cycle, as you can see up the top there. So the key points are follicle stimulating hormone causes the egg to ripen in the ovary. Luteinizing hormone causes the egg to be released from the ovary. That's ovulation. It then becomes what's called the yellow body, which will produce progesterone, which keeps the lining of the womb thick, getting it ready for implantation of the egg. So if the egg becomes fertilized, estrogen and progesterone levels are kept high. This has two effects. Not only does it keep the lining of the womb, but it also stops another egg from maturing. As I said, this is often shown in graphs. So this one covers the two main ones that we're going to focus on first of all. We have luteinizing hormone here that spikes, a big spike in luteinizing hormone at the point of ovulation. It in fact triggers ovulation. So if we start from here, you can see that the follicle stimulating hormone rises and keeps high as it goes through, causing this egg to mature within the follicle. Estrogen and progesterone in turn, their key bits come in after ovulation, progesterone keeping the lining of the womb thick, and estrogen keeping and helping to maintain that. Estrogen also has the effect of inhibiting follicle stimulating hormone. Another effect estrogen does is that tiny rise there, it's hardly anything, will cause the lining of the womb to repair. So this here represents the period, and then the lining of the womb will start to repair after that. What's really interesting about the hormones in the female reproductive system is they all work in tandem with each other. One thing doing something and inhibiting or triggering another effect. So the four key hormones are shown here, and I really like this diagram because it shows exactly where they're produced. The first one we're going to look at is follicle stimulating hormone, which when released will stimulate the production of estrogen. Estrogen inhibits follicle stimulating hormone. Basically, whilst the lining of the womb is being repaired, we don't want too much follicle stimulating hormone to be released. Otherwise, the egg will get ready too quickly, it will mature too quickly, and be released before the lining of the womb is ready. Once estrogen levels spike, they will stimulate the production of luteinizing hormone, which causes the egg release. And luteinizing hormone, in turn, stimulates the production of progesterone, which keeps the lining of the womb thick. Progesterone stops follicle stimulating hormone from being produced until progesterone levels start to drop. So if the woman becomes pregnant, progesterone levels will stay high for the whole 9 months. If she doesn't become pregnant, they'll drop down at about 28 days and follicle stimulating hormone will no longer be inhibited and will start to cause another egg to mature. So it's nicely highlighted on here. and the key points are outlined what they do. What I also like about this diagram is it shows the two key hormones that are made in the pituitary gland and the two key hormones that are made in the ovary. You need to know those because they often ask where they're made. The diagram shown here really helps to illustrate what happens with the different hormones. So what I'm going to do is I'm just going to sort of annotate around here. So from the follicle here, the immature follicle, all the way round to ovulation there, that is all controlled by follicle stimulating hormone. So FSH stimulates the immature egg to start to mature, but doesn't actually cause its release. It just starts to grow within the follicle. The follicle swells to accommodate it. At ovulation, this is luteinizing hormone. So luteinizing hormone spikes at this point, and that triggers ovulation. And then the final point here is the corpus luteum, the yellow body, will produce progesterone. So the actual follicle will collapse in on itself somewhat and become the corpus luteum, the yellow body, which will continue to produce progesterone if the woman becomes pregnant for 9 months, if she doesn't, for about 28 days. It then starts to drop down again and the cycle repeats. Just as a little extra point, the corpus luteum degenerates into a little scar, which is known as the white body. This next graph here looks confusing, but actually if you follow the numbers as you go along, it really helps to highlight what's happening. So if you start at 1 here and follow the numbers through, follicle stimulating hormone rises a tiny amount, and that in turn stimulates the follicle to develop, which causes those cells, the follicle cells, to produce estrogen, which causes estrogen levels to rise that tiny little amount. It's hardly perceivable, but that is enough to trigger the stimulation of the repair of the uterus lining. So after the period, the lining will start to repair itself. Moving to the top, as I stated, estrogen will inhibit follicle stimulating hormone. It doesn't want to mature too fast because the lining is not ready to accept the egg yet. After a certain time, though, as the follicle continues to grow at 7 here, estrogen levels will be triggered to rise a large amount, which in turn will stimulate the production of luteinizing hormone. There'll be a big spike in that, and ovulation will then occur. So the egg will be released about day 14. After day 14, the empty follicle now collapses in on itself and becomes the corpus luteum, the yellow body, which will help to maintain the lining of the womb by producing progesterone. So progesterone is made, which down at 13 here you can see helps to maintain the uterus lining. It also has the effect up here of inhibiting luteinizing of follicle stimulating hormone. You don't want another egg to mature whilst there's one in system. You want to keep everything in check until the body finds out, for want of a better term, if the egg is fertilized or not. So assuming the egg doesn't become fertilized, the corpus luteum degenerates down into the white body and progesterone levels fall. That causes the start of menstruation as the lining of the womb is no longer needed, so it gets shed. And that means that the follicle stimulating hormone is no longer inhibited, so the cycle starts again. So from 18 there to 19 and then back to 1. Hopefully that's kind of cleared up some of the misconceptions there, some of the difficulties. The best diagram, I think, is the graph that we just looked through and the one that shows where the hormones are produced and what they do. But again, refer back to the reproductive hormones. That will really help with a lot of questions. I've got a few facts to finish off on before we look at contraception, which is quite an easy topic, and in vitro fertilization. So just a few interesting points. You can read them yourself, but actually women are born with every single egg they're ever going to need, but they degenerate over time. So it's quite interesting. They have about 7 million eggs, but by birth they've already dropped to 2. It's the largest cell you can see in the human body. It's about half the size of a full stop. It comes from the term egg keeper, so ovary literally means egg keeper. There's some strange, interesting facts about the menstrual cycle and synchronizing periods. You may have heard of this, and they're a bit unsure whether it occurs or not. But there seems to be some evidence to suggest that women synchronize their periods. There's also some suggestions that lights may be influencing the menstrual cycle. And just as a bit of retail therapy as much as anything, they seem to be this link between shopping sprees and the fluctuating hormones. Contraception and IVF is all about preventing or promoting fertility. Both are kind of essential at different points. There's lots of couples that struggle to have children, and there's lots of couples that don't want to have children. So these are ways of going around it. It looks quite involved, but actually the principles are quite simple. The first thing is IVF. It stands for in vitro fertilization, and it's often referred to, sort of named as test tube babies, because in vitro means in glass. So the media got onto it and they coined the phrase test tube babies. And it works best with younger women. So it's not usually done with older women because there's a very little success rate. But it's used more with couples that got fertility problems. So it's sometimes blocked fallopian tubes. It may even be low sperm count or something like that. Getting back to the age of the women, as you can see from the graph there, under 35s, about a 32-33% success rate. Over 44 drops to below 5%. So there's a big drop off with the age of the women. So it's best done when they're under 35. And like I said, it's used for infertile couples. The woman is first given an injection of follicle stimulating hormone. This causes lots of eggs to be matured in the ovaries. You want more than one egg to be released. Then the woman is given an injection of luteinizing hormone, which causes all the eggs that have matured to be released, and they are then collected from the woman. It's quite a painful looking picture, that, but it's actually how they remove the eggs. They siphon them out using the needle there. So they go through the vagina and under local anesthetic, and they then remove the eggs and they allow them to be fertilized outside the body, hence why in glass. So the eggs are collected. They are mixed with sperm in a specialized fluid, which is going to keep them not only warm, but also keep the egg well nourished. And then of the viable embryos that form, so the ones that start to divide, they take one or two of those and then implant them into the uterus. It completely cuts out the fallopian tube there, so avoids problems with blocked fallopian tubes, that sort of thing. I'm not going to go into too much detail about contraception because it's quite a simple process. You can read up about it at your own time, but you've got to know there's chemical and barrier methods, and there's also different methods such as avoiding intercourse at all times anyway, or only having intercourse at times where the woman is fertile. You can either avoid having intercourse then to stop pregnancy, or you can have intercourse then to promote pregnancy, depending on what they want to do. There's also the oral pill and the patch, and there's other barrier methods such as condoms and diaphragms. There's also femidoms as well. Final things are you can have implants, which are put into the arm usually, and they can last up to 5 years. Or you can have surgical sterilization, such as a vasectomy, where the sperm ducts are cut or the fallopian tubes are cut. Or you can have the coil put in, which contains hormones, which will inhibit the egg development, and also it blocks the uterus, so it's less likely for an embryo to implant. So, final factoid is about the first test tube baby. It was Louise Brown. She was born in 1978, and she made front page news at the time because it was such cutting edge technology. As the first time anything like this had ever happened. The first time an egg had been fertilized outside the body and then implanted back into the body. So it was quite a miracle birth in some ways. And they coined the term super baby there, and also test tube baby was coined at this time as well. They'd been trying for 9 years to conceive because she had a blocked fallopian tube. This allowed her to give birth. Anyway, that's enough about that. Hope that's helpful. Thanks a lot. Bye.